Welcome to the CBIA BizCast powered by Google. On this podcast, we dive into stories about Connecticut businesses.
Downs Construction actually came to my school.
And business leaders.
I think it's always also really important to be able to see a path forward.
We're shaping the future of Connecticut's economy.
Today we are joined by a company that really has made a commitment to improving the economy, especially here in Hartford. We're at Hartford Healthcare with President and CEO Jeff Flaks.
Hi, how are you?
Welcome to the podcast.
Delighted to be part of it.
And I do want to talk a little bit about this new commitment that you've made to the city of Hartford in just a little bit. But first, let's talk a little bit about you and where your passion for Connecticut and Hartford comes from.
I'm a native son of Connecticut. So I was born and raised in Connecticut. Both my parents were public school teachers, had a combined 83 years of service here. My sister is a teacher in Connecticut, so our roots are deep. I care tremendously about Connecticut, and I just think that our state has tremendous upside, an amazing culture, and I think our best days are still remain in front of us.
And I know you dipped out a little bit and came back to the state. What brought you back? Is it that commitment to making the state better?
It's the culture. I think this is a wonderful place to live, to raise a family, to retire, to receive healthcare, world-class healthcare. We have amazing educational systems. So I'm tremendously pro-Connecticut, but you think about the lineage, the richness of the companies that have been here for hundreds of years, including ours. This is a wonderful ecosystem, and it's a place that great things can happen, great things have been invented, and more will come.
This is a really special day that we've been waiting a long time for.
As we kind of sit in this building right now, this beautiful wall is just one of many. Here, we're on the corner of Pearl and Trumbull Street. This is the new headquarters.
This building and bringing 700 people here is about starting a movement in Hartford.
Yeah, I'm so proud that we did this and that we're here. See, our origins in Hartford go back 200 years. The Institute of Living was founded in 1822. So when you think about our commitment to Hartford, it goes back centuries. But this is a recommitment. We had a choice where we could put our headquarters. Our clinical locations will be all over Connecticut. We have 430 locations. We need to be where people are. We need to deliver care closest to home, where we can do it most affordably with the highest quality. But a center like this, where we have 700 professionals working, it could have been anywhere. We chose Hartford because we want to be part of the reigniting this city. And we felt that healthcare is a driver of the economic health, prosperity of the region. So it was very purposeful, very deliberate. Why here? Why this location? And why now?
And a lot of people are going to be coming in. This is where you're based.
That's right. So my office is here. We were very purposeful about who is here. So it's our legal team. It's our supply chain team, our treasury team. It's our strategy and marketing and planning teams. It's a whole series of groups who come here. It's our human resource and staffing team who do business. So people who create commerce. So they will bring people in who use our airports, use our hotels, our parking garages, our restaurants. We're looking to be a stimulant and to support small business and to support Connecticut businesses. And I'm very proud of our commitment. One of the things we just announced recently, this year we just closed out our data for fiscal year 2022. And we did over $100 million of purchasing with minority-based organizations. Just 2 years ago, that was $29 million. So our focus on supporting equity, supporting minority purchasing coalitions, and supporting Connecticut-based businesses is very real. And this entire center of the 110,000 square feet, 98% of it basically was built by Connecticut local organizations and firms, which was, again, deliberate.
Again, I don't want to spend too much time talking about the makeup of this building, but it is important. There are a lot of businesses right now that are looking at redoing their office space. And I know that there was a lot of very deliberate things done here. Can you talk about some of them?
This is about collaboration. It's about culture. But most important, it's about innovation. Our premise in healthcare is that healthcare has to become more accessible. It must become more affordable. It needs to become more consistent. Quality is way too variable. And if we learned anything during the pandemic, it's not equitable. So in this moment, we have to, you can't solve today's problems with yesterday's solutions. So we tried to reimagine a space that supports collaboration, alignment, culture and engagement, and ultimately innovation. So at the hub of this I think of it as one big accelerator. And on the first floor, the first thing you walk into is our launch space, which is the Hartford Healthcare Innovation Laboratory. And we're going to be building new solutions. We're going to start new companies here. We're going to bring, as a med tech accelerator with Trinity College, we'll be bringing all these organizations who are startups here and use the Hartford Healthcare ecosystem, what I call the sandbox, to help develop new things that hopefully create new jobs, new taxpayers, and new solutions to create better and more world-class healthcare here in Connecticut.
Can you talk a little bit about that partnership with Trinity and what people are going to be doing here?
It's a wonderful partnership. Talk about organizations with rich histories, right? Trinity goes back 250 some odd years. Hartford Healthcare, 200 years. We've been neighbors since the beginning of time. This is an incredibly enduring partnership. President Joanne Berger-Sweeney is an exceptional visionary leader. She's a neuroscientist by training, so she has a personal passion and understanding of the need to reimagine healthcare. So the partnership with the MedTech Accelerator is marrying Trinity College's students and emerging students and their faculty and professional staff with the Hartford Healthcare sandbox, so to speak, to attract companies who want to come here. And we provide seed money, and we provide talent, and we provide a physical environment for them to work within, and access to our hospitals and all of our healthcare services to create new companies. So it's really a terrific initiative. We have a firm we work with out of the Silicon Valley who provides startup support and advisory services to these new companies, and hopefully we're already seeing some of the trends, that some of the solutions that are coming forward, we're applying them and it's making a difference here.
And I'm sure just working at least down the hall really from some of the people that you really want to get an ear for 5 minutes is helping motivate.
It's what makes us different. It's our culture. So if an organization is working, we built one of the world's most significant robotic surgery applications here in Hartford. And they built it over 9 months in our Center for Education, Simulation, Innovation. So when they needed a certain type of surgeon, that surgeon would be there in 20 or 30 minutes. At the end of the day, if they needed to try a new application on a mannequin, they had our team, our entire healthcare team organized there. So this notion of access to the talent, real time, so during the R&D process, you're getting constant feedback. It accelerates research and development, and it makes it better. And that's what we bring to the table. So it's marrying our resources with these different companies who have brilliant ideas and exceptional people. And you put it together, and it creates new ways to deliver healthcare.
And I think, when people think healthcare, they think hospitals, and now we're talking about, economic development in Hartford. Why do you think that is such a crucial part of your overall success here?
It's about recognizing we have a broader purpose. So first and foremost, we are committed to ensuring everyone in Connecticut has access to world-class healthcare, and that we do it affordably with the highest level of quality, and we deliver it equitably. Right? That's our primary mission. But in addition to that, we have to recognize that we have a huge impact as the second largest employer in the state of Connecticut. As an organization of our size and scale, we can do more. So Google just joined us with this wonderful announcement. They're investing, over $12 million in this partnership. And we together are going to look to solve a global problem here in Connecticut that can be extrapolated around the world around patient access. So why did Google select Hartford Healthcare? Because we have scale, because we have technical expertise, because we're organized in an integrated fashion, and because of our culture and the progress we've already made, and this notion of our demonstrated excellence around innovation. So that's what we're about. And if we can bring more Googles here, if we can do more companies like that, that's good for everyone. And that's our job. It's to try to create as much success, prosperity, and clearly health and wellness for our entire community.
Yeah, you've gotten that recognition on that, really international scale that there's good things done here. And I think it says it on a couple of places in here. The future of healthcare starts here. You really believe that?
Begins with quality, right? Our quality is now ranked at the top levels in the United States. You could, as an example, our Heart and Vascular Institute, the quality we're producing the Heart and Vascular Institute, it's in the top 1 and 2 percentile in the world. So nobody needs to leave Connecticut for those services. People come to Connecticut, right? We're an importer for those types of services. So we can create quality here in Connecticut that can be truly second to none. And we're doing it. So this is something that's no longer even an ambition, it's a reality. What we have to do is do it, in every aspect of our services, and ultimately create a health system that's more reliable, safer, and that can deliver care that with that level of affordability and equity that can be a national model. We think Hartford Healthcare is a national model for the country, and that is why Google selected us. I mean, they want to work with somebody who's a national model.
Definitely. And let's talk a little bit more about that partnership. So you guys are going to be moving all the data over to the cloud. What does that mean? What does that look like? So,
we're an entrepreneurial organization. Our team is amazing. I'm so grateful for the tremendous people. We have 33,000 colleagues here. But this is really a brilliant partnership, because when we migrate Hartford Healthcare's data to the cloud, we're going to save close to about $4 million a year. What we're doing is we're taking that $4 million savings and reinvesting it in the partnership with Google. So through that investment, that will fund the accelerator that we've created to really transform access. So you think today, no one should wait for a physical 10 months, right? A cancer patient shouldn't wait 3 weeks. When we see the delays in care that occur, that impacts health and wellness and early diagnosis, and it impacts the overall quality and life expectancy in some instances, we have to change that. And it's a global problem around the world, but we're going to address it here with Google. But the beauty of the partnership with Google is we're effectively self-funding it from the improvements and the cost efficiencies we're generating through the cloud partnership. And that money gets reinvested now in the accelerator, and then Google's putting new money into the accelerator. And together we're going to know right in a few short years if this has application to go across the globe. But it's going to start here to the benefit of the residents of Connecticut.
So what kind of applications are you testing?
Amazing things, using artificial intelligence, using predictive analytics. We have so much data, but it's harnessing this data. For over 10 years now, we've been building this digital highway. We have a single health record from home care to outpatient rehab to behavioral health to primary care to everything else we do up into including our hospitals. So how do we harness that data? And that's what Google's going to help us do, so that we can predict what people need, when they need it, and we can really help manage as a partner their healthcare. And think about for a moment, we have almost 4,000 providers. So we can meet people's needs. But today we rely on consumers, right, to call. The patient has to call this office, that office. They have to try to understand the healthcare system. But we have so much more capabilities through the AI lens that we're going to be able to meet people where they are. And we're going to be able to think about every aspect of your life with Amazon, with the way people get goods and supplies, the way they order transportation, the way they get food. That can happen in healthcare. With Google, we're going to leverage what's occurred in other industries and bring it to healthcare. It's never been done before. But we have the resources. It's a matter of arraying them the right way and putting that high-tech kind of set of solutions with a high-touch approach. And that's the game.
Well, we're really excited to see, what happens. And I think for a lot of patients, this is going to hopefully be a game changer.
Massive difference maker, massive difference maker. And every person deserves this, right? I mean, it shouldn't be because somebody knows somebody or somebody has to fight their way into the health system. The health system needs to work for them. All right, so this is what it's going to do. We're going to democratize kind of the way that people access care in these situations, using these types of capabilities so that everyone gets that level of immediate access to care. It can be done, and we're going to figure out how to do it.
Now, you're really leading this company on such a large scale right now, making this decision to move here, this partnership with Google. What recommendations do you have? We've got a lot of business leaders that listen to this podcast for taking that leap. Is it believing in your staff? Where does that come from?
So we have great ambition and fundamental belief system and led by a values-based organization. So it really begins with our people, right? We have amazing people. It's the culture of Connecticut. It's the culture of what we've created here at Hartford Healthcare. But our aspirations are substantial. And we believe that Connecticut deserves world-class healthcare. We can do that here. We also believe that we can be a model health system for the country. So our contributions, what we're creating, has much broader implications. So my advice and counsel is, Connecticut has all the tools. We have the educational systems. We have the talent here to draw from. We have a culture of collaboration and alignment and well-intended people who work together across different industries. So I'm so pro the Connecticut business community. I'm grateful for what CBIA does all right, which is critical to creating the sense of community. So I believe it can be done here. And one example is we have a wonderful partnership with the Dean, Demetrius Pertsimas from MIT, who helped build a company within Hartford Healthcare that we're now marketing across the country called H2O. And it's a company that looks to optimize operating room efficiency so that care can be delivered more affordably and more efficiently. There's a lot of waste within operating rooms and operating room schedules. That could have been built in Cambridge. It could have been built in Boston. It was built here in Connecticut. And what's so wonderful is, is MIT, he would tell you coming out of MIT that it's the very special relationship that he sees with our people of collaboration, support, and talent. That perfect kind of fusion.
And obviously the pandemic, we can't talk about this, even to have this conversation without discussing it to some level. But I want to know how you think it motivated you and other people. We hear all the time some people were just working crazy hours and get bogged down, but you guys really used it to change.
Made us better. We said throughout COVID, it was very clear to us from the very beginning that, one, we would get to the side of this, right? If you look back in history within our country, right, we've always overcome obstacles. So we had a long-term point of view that we were going to get to the side of this and be better. But what we also recognized that the pandemic taught us a lot. And it taught us that there was an absolute mandate to focus on health equity. It showed some of the inefficiencies nationally around supply chain operations, around personal and protective equipment. We learned a lot around infectious disease procedures and so forth. So as we had these learnings, I said throughout COVID, I said, our ambition is not to go back to normal like it was in so many parts of our lives. It was to be better than normal. And we already are better than normal. So COVID in many ways catapulted us through these learnings to be better. And healthcare really has never been better than it is now. And I often describe in the future, right, this is the worst it's ever going to be because we're getting better every day. And COVID helped us in that regard. But again, I have to recognize the people who worked caring for people. I've never seen devotion, excellence, courage, bravery, commitment like I saw during COVID, from our doctors, nurses, all of our frontline team members who worked in dietary, food services, respiratory, all the different things our teams did. It's beyond description, no words.
And as a leader, that makes you want to work that much harder for them too.
It inspired me. It just inspired me. What I saw kind of in terms of the human spirit, helping people when they're in greatest need, the vulnerabilities our community felt. And when people were running to home, right, to shelter, our people were running in, right, to help, to support their community, to support people in those greatest moments. There's no words to describe it.
Now, this partnership with Google, is this just the beginning? I'm sure there's other projects brewing in the back of your head right now, but what can patients and other business leaders expect?
There's a mural right around the corner, right? It says, "The future of health starts here." This is just the beginning. And in many ways, it's not even the beginning. We've been doing this. It's a continuation. It keeps evolving and taking us to that next level. But we see such a bright future in front of us. We see so many opportunities. And we're able now to imagine things today we couldn't have imagined even 5 years ago because of the progress that's been made. So we have to keep challenging ourselves to think differently. Look, this building was built with no straight lines. And people say, why? It's noticeable when you come in it. There's no straight lines because we can't color within the lines. We have to break through the lines. We have to think differently. Healthcare has to get better, has to change in so many different ways around access, affordability, quality, equity. And to do that, it requires us to think differently. So these types of innovations, they're not a nice to have, they're a must to have.
And when we think about, the greater community, going back to how we started, thinking about Connecticut's economy, making Connecticut a better state, what is one of the things that you think is most crucial to its success? First,
healthcare is a foundation. So people need to feel very comfortable having their family here, raising their children here, retiring here, ultimately getting end-of-life care here. So we need to have world-class healthcare. It needs to be accessible and affordable, clearly. But to me, it's building on the energy and momentum of this state, and seeing the new initiatives that are happening around us. This state is a historic state. It's a very special state. It's got a great, rich tradition. But our job, people like me who are in these roles today, is to look forward and imagine what it could be, and to build on that history, but to take it to the next place, while we're in these roles, and not waste one of these moments.
Awesome. Well, thank you so much for, sharing this with us, and for being down here in Hartford. I think we'll be, running into each other on the streets more. So we're happy to have you here.
My honor. Our team's going to be all over the streets. That's part of the goal. So thank you so much. It's an honor to be part of this.
All right. Well, thank you so much for listening to this week's BizCast. You can listen to more episodes and subscribe on Apple or YouTube. And for more episodes, head on over to CBIA.com.